everyone, it's Michelle from the Colorado Wolf and Wildlife Center, and I'm here with Navi and Tala again. And today I wanted to talk a little bit about something different from our usual topics, and that is the veterinary care that our animals receive. So Navi and Tala here, they are our oldest animals. Tala is 16, so she's actually one of the oldest wolves we've ever had. And then Navi here, he's 15. And he is going to hang out in his house here because he actually just had surgery a few days ago to get a mass removed on his shoulder. He does tend to get these, they're non-cancerous masses, they come back every couple of years. So he's still on some pain meds and everything just so he can heal up really well. But we do a lot of care for these guys here at the center itself. So Navi's procedure that he just had done, getting that mass removed, anything like vaccinations, minor surgeries, so any types of like spay or neuter that we might do, which most of our animals are just neutered. We don't usually spay our females. There's been some that have, but for the most part we just neuter our males. All those minor surgeries actually happen right here on site, and we'll actually take you into our vet room to show you that here in a little bit. But typically what we'll have is we'll have our veterinarian, Dr. Voles, come out on site and he'll treat the animals right here. So we have a nearly completely stocked vet room, so we can do all of those minor surgeries and minor treatments, but anything major we have to take our animals off site, which we're actually going to talk about here in just a few moments, because just a few months ago Jakara, our youngest male wolf, he was only 2 years old, actually got a really cool procedure done. He actually got an MRI, so we had to take him all the way up to Parker for that, which was a really cool and unique experience, which we'll have some videos for you here in just a moment and some pictures. This big handsome guy here, this is Jakara. You've all seen him before. We haven't done a wolf talk with him in a little while, but you've probably noticed as he walks, he's a little bit wobbly. So back when we were having winter, Jakara here, he loves to play really, really rough with his sister Zara. And what we think happened is that she actually was playing a little too rough with him, and she probably knocked him over on the ice, and he tweaked his back a little bit. However, after a couple weeks of observation, when he hadn't really shown too much improvement, we started to do some problem solving. So first off, we had our wonderful vet come on out here. He did a checkup on him, and we did decide to do some x-rays with the Jakara at that point. But the x-rays didn't show any fractures or anything like that, so that was really awesome. And then, thank you. So after a little bit while longer, we were able to coordinate between our veterinarian and a veterinary specialist up in Parker to actually get this big guy in an MRI. And if you've never seen an MRI, they're kind of like these big giant tubes, and you would think it's very difficult to get a wolf in. So Jakara, he actually was anesthetized. We took him all the way up to Parker in our truck, and then once he was there, he got to go into that MRI to kind of see what else might be going on here. But thankfully it showed that he didn't have any severe type of injury or anything like that. So it kind of goes back to our veterinarian's original hypothesis that he probably has a small embolism that just kind of settled there in his spine. Now, while he was at the vet, he also got a spinal tap just to make sure that they could check to see if there was any infection, which thankfully he doesn't have. So this here is our on-site veterinary room. So this is where all those minor procedures and surgeries happen. Again, our veterinarian does come out here to visit us. So he brings all the other equipment that they might need, and all of those minor procedures take place right here. This helps reduce stress on our animals because we don't have to take them off site, put them into another strange situation they might not be comfortable with, because having a veterinarian poke apart them is already sometimes a little bit stressful. So we want to make sure that we reduce that as much as possible. Over here we have that small little kennel where the animals can wake up from their anesthesia, as well as just kind of generally recover. Occasionally we might use this room too on really, really cold days when we might need to bring Coco and Pono inside. But for the most part, this is just where our veterinary processes are housed. So I hope that you all really enjoyed learning about our veterinary care here at the Colorado Wolf and Wildlife Center today. If you have any questions, let us know, and we will talk to you all next week.